We also have a great program for the prevention of pressure ulcers in skilled nursing facilities, where we take them through an assessment and 8 30-minute presentations, a quality improvement initiative that you start teaming up with skilled nursing facilities, and you carry them through what amounts to an outcome-based quality initiative plan. And all they do is document what you're doing for them, and you've done it. You have created their outcome-based quality initiative for their poor short-term care discharge of pressure ulcer patients. So if you're interested in those presentations, it's first come, first served to a market. A couple of markets are already locked out now with some of our coaching clients, but they're $497, and they're modified to your agency. It includes your pertinent information. They're open documents. You can make changes as you represent to all your referral source, and you'll be the only one in your market to have these presentations. And they do include a 90-minute consultation with your core team. In other words, we'll tell you what the presentation is representing and the responsibilities for you to pull it off. But on the subject of CHF, this is how you should present your program. First, you tell them a little bit about what you know. Now, these are 2009 numbers, but it's nearly 1 million hospitalizations now, and it's most common first listed diagnosis. And it's been targeted by CMS as a primary diagnosis in the reduction of readmission to hospitals within 30 days. If you are a home health skilled nursing and therapy agency and you don't know how to look up outcomes from hospital readmissions or the new outcome payer models for disease-specific payment back to the hospital, then you need to sign up for a coaching call. I can show you in 5 minutes. Light bulbs will go off. You'll know what you need to say when you're calling on a hospital. So we'd start out with a brochure. We start out with a brochure, and remember, we're going to do a presentation on here's what we see as a problem, here's our solution, and here's our expected outcome. So a brochure would be your first program component that would be for the purpose of sealing the deal of the difference between the acute episode and the managed care episode. In other words, you would present your brochure in this way. Dr. White, we understand that some patients come back to and are readmitted to the hospital in the first 24 to 48 hours before home health goes out and make themselves known to the patient and their family as their care provider. What we want to do is provide them patient education immediately upon discharge from the hospital, call into the home within 2 hours, tell them that their acute episode is over, their managed care episode has begun, and we're the experts of their managed care episode. By doing this, Dr. White, we expect to reduce the amount of patients coming back in the hospital the first 24 to 48 hours by 50%. That one segment, you drew it out, you painted the big picture, and now you're off and running. Dr. White, we know some patients return to the hospital because they're non-compliant with medications and treatment and lack of knowledge of a successful recovery program. So what we want to do is we've created this patient teaching script. It's written on a 9th grade level. We're going over all the patient's medications, all the patient's treatments, when they're supposed to come back to the specialist and the primary care physician. We're answering every question they have at the point that we open the patient up for home care. And by doing this, the outcome is we expect to reduce the number of readmissions to the hospital for the core reason of misunderstanding medications and or their care process to be reduced by 50%. So you go on discovery, benefit, outcome. And you can go further. Dr. White, we know that some patients are coerced by caregivers and family members into going back to the hospital because they don't know what else to do. So we're going to do patient caregiver and family education and give them a pathway in which we put ourselves in the middle. In the green zone, everything's okay if you have these symptoms. In the yellow zone, you need to call the home health agency, and maybe you need a medication change, or maybe you need to be seen by your general practitioner, but only in the red zone with these specific symptoms should you return back to the hospital. So we're going to put ourselves in the decision-making process, and by doing that, we expect that one population that are returning to the ER due to family and caregiver influence to be reduced by 50%. And you keep going. A comfort call into the home to make sure that they're compliant daily. The benefit is that compliant patients, you can catch weight gain with CHF patients earlier. You can check when they're out of medications earlier. You can adjust dosage of medications such as diuretics earlier. So you publish each component of a care plan and present it as a total care package. We know that CHF, patients being readmitted to the hospital, is not a huge fire. It's not a forest fire. It's several brush fires, right? We're putting out one fire at a time. And you show us another fire, we'll come up with a better mousetrap and put that out too. And we're going to be the care provider of choice because we're going to actually listen to your suggestions and actually have results. At the end of the presentation, you would say, Dr. White, this is our mousetrap. This is how we care for CHF patients. We're driven to reduce this hospital's readmission rates by 50%. We'd like 20 patients in a clinical trial. We'll publish a white paper at the end and give you the results. But I don't think you're going to find a better care model in our community, and we'd like to start today. That's your call to action. So use your reduction in hospital readmission rates as a starting point. And you can enter the ACO program with certain hospitals. You can enter in a community-based transition program. And by the way, we're going to have a webinar on that later on in the summer series. But their possibilities are endless, right? Here's a neat cell tool that is designed by TAG. You can't buy it anywhere else. We came up with it. We invented it. It's one of our biggest sellers now. And what it is a bridge between the DRG codes for physicians and the ICD-9 codes that we bill to Medicare through. So we give the physicians all 10 major headings of ICD-9 codes, and we list them out with expected diagnosis that we support in home health. And by doing so, it helps them draw out different diagnoses on the home health order. And the more diagnosis, primary diagnosis, secondary diagnosis as they list, the better our HERD scores and reimbursements are. So it helps in that matter, but it also is a quick reference tool for these physicians. And on there, when they're looking up, and it goes through all 10 major header codes of ICD-9 coding, when they're looking at a specific diagnosis, like diabetes mellitus, then it lists the home health services on the bottom page of how home health skilled services can help that patient. And it lists 15 or 20 benefits of referring a patient to home health. And it also lists therapy services that are available. They're very popular. I'd love to, and I always get the complaint, how much are they, Eric? Well, they're about $5 each, but they're a piece that you can make at least 14 sales calls with a physician using this piece, because every different ICD-9 major header, you're going to bring out disease-specific talking points, and your talking points for skilled nursing services are on the flip chart. So you would give one to a referral source, and then your sales staff would show up, and that's the conversation talking point, unless the referral source takes them in a different direction. If they do, then your sales rep just turns to a different tab, and they still have their talking points. So the price of $5, that's like a dozen Krispy Kreme donuts. It's less than a dozen bagels with strawberry cream cheese, which are going to go stale by lunch and be thrown away, and who knows who left them, right? You give them this, it's branded to your agency, it's a tool that they'll use. It has some neat addendums in the back. Well, Physician's Guide to Medicare, it's got a decision tree on whether or not they would qualify for home health services, and it has a definition of homebound status. which is one of the major reasons why we don't get more from general practitioners. They under the misguided notion that if a patient is making their appointment in the office, then they are automatically not homebound. We need to, once a quarter, re-educate our referral sources on homebound status as it is defined by Medicare. And it also has the 10 most common primary and secondary diagnoses for home health. So it's a great education tool, not only for your referral sources, but of course for your sales staff as well. Now I want to change the focus off of skilled nursing and therapy services, but I want to make an offer to you. If you contact me for a coaching call, I will give you the new guidelines for nursing home provisions that are coming out about all their mandates, their PPS revisions that start October 1st. You need to know all that. And I'll give you these documents from other sources so you can learn. I'll also give you some great independent webinars. We didn't create them, but I'm going to pass them along to you on value-based programs for hospitals. You need to know how they're changing, how they're getting paid, and what their penalties are. So remember that, and at the end, just write your information in the question and answer block or give us a call. Now we're going to switch the focus to disease-specific marketing for hospice. It's near and dear to me. Hospice is kind of a do-not-enter zone for marketing. We don't want to get too aggressive. Our message is our message, right? It is one of compassion. It is one of patient care. But there's some critical, specific benefits that you guys should be talking about. And that is length of life is increased under palliative care, under hospice care, than under curative pathways. So you go to a National Hospice and Palliative Care Organization, they printed specific data. And there's a new study coming up with 2007. How many days increase a hospice patient has versus if they stayed on a curative pathway? The average is around 30 days. So length of life is increased with hospice. We need to get that message out. And also, mental quality of life. The National Hospice and Palliative Care Organization is funding this study. It's quality of death surveys. And I'm sure some of the hospice agencies on the call today have heard about that and are involved. But part of that is the emotional ease that hospice service can provide the hospice and palliative care patients that a curative episode couldn't. But again, as a hospice marketer, we have to go out with unique message. We can't go out with our compassion message on every sales call. So we need to take patient populations, one disease-specific end-stage indicator at a time. We need to have talking points on when to refer to hospice, benefits for that disease-specific population in coming to hospice, and talk about our agency, our nurses, our caregivers, in our work that we do in the community. So we would start with a hospice brochure specific to a certain population, like congestive heart failure patients. And remember, it says what you want it to say, because we own our own collateral here. So hospice disease brochures, you're going after a single slice of the pie, again, with referral sources. A lot of them, they don't even realize how many of their patients could actually benefit and qualify for a hospice. Dementia patients, COPD patients. If it's not cancer, a lot of clinical referral sources, hospice is not first of mind. It's not top of mind in the service to help these patients. So we go out and we make our case one disease-specific indicator at a time. And we do it with brochures. And we also have a guidelines for hospice admission, which walks them through all 16 accepted end-stage indicators and when it's appropriate for a hospice referral. So one visit, you're talking about dementia, end-stage dementia, stage 4, when they're no longer able to verbalize their need, and that is the indicator. Or they're talking about ALS, post-stroke, coma patient, Parkinson's, end-stage renal, you name it. But we're specific, and we're drawing the full picture on the benefit that this patient is going to receive with a hospice referral. And we're not talking in generalities. We're talking about specific benefits for specific individuals that are in that physician or clinician's care. A guidelines for hospice admission booklet, our flip chart, is good for visits to the same referral source all year long. It's got that much information in it. They were, I think, our second biggest seller last year. They have the Palliative Performance Scale guides as an appendix, the New York Heart Association functional classification as an appendix, and the FAST testing, the functional assessment staging test, all in one flip chart with your logo and contact information clearly visible on the front. Here's one of our popular and very effective pieces of collateral. It draws the picture of a hospice patient episode, a typical hospice patient, and when to refer, and it draws out the picture of the success that occurred during a hospice episode, or palliative care episode. So you would put your agency there, you would brand them, they look like you want them to look, but it talks about that specific patient diagnosis, and it can be a specific patient that you've cared for in the past, or it could be a sample of like an avatar patient, just a sample patient that you're describing. But it paints the full picture to the clinician of what to expect is going to happen, and gives a case report for, in this case, is end-stage liver disease. Once they go on there, it talks about when it's appropriate to release the patient to hospice, when they're going to benefit the most, and it talks about a case report about a successful hospice episode. I've been touched by hospice episode, and I can tell you, man, that was the way to go. They provided the family, the friends, information in such a way that it kept us more at ease, and it kept my good friend more at ease. So it's near and dear to my heart, and you guys need to market those stories to the clinicians and tout the benefits of the palliative care services that you're providing. Now here's where it gets fun, because I'm really big advocate of private duty services going disease-specific marketing. Before I go into it, I want to just be honest with you. This is what I call the red ocean strategy, and the red ocean strategy means you're going to a clinical referral source, so you're going to have to make your case with all your competitors because they're all over there. I call it the red ocean because there's sharks in the water, there's blood in the water, because everybody's going and hitting the hospitals up. Everybody's hitting the skilled nursing facilities and doctor's offices up for private duty services. You need to concentrate a lot of your time and effort in community education and going out into the seniors still living in their home, figuring out creative ways to reach the seniors, packaging your services as opposed to putting out hourly rates. And we'll talk about that in a little bit when you're looking at these screens, but that's the way you go. You need to get them from the blue ocean, but if you're going to fish in the red ocean, here's the best way to do it. You go one disease-specific patient population at a time. Draw out how your private duty services can help that client that they're discharging with pain management diagnosis. And by that, I mean you have a care package specifically drawn up for a pain management client. Maybe it's a rheumatologist, and you've added certain no-brainer benefits to your care package. And your care package is going to consist of the normal things like assistance with bathing, dressing, meal preparation, medication management, but you're adding laundry to the rheumatologist care package because you know that it's hard for people suffering from arthritis to pick up wet clothing and load their washing machine. And a lot of them are spending more money on laundry services than it would cost you to come in the home with your total care package. But put some thought into it, customize it, and lead with your benefits. Don't lead with your price. If you're leading with your price, that's what you're going to be compared to. They're going to shop you. If you're at $20 an hour, they're going to look at somebody at $19.50. However, if you're drawing out a care package that can't be replicated by any other provider in your market, then they have nowhere to compare you to. And you can do it for all these diagnoses. Alzheimer's, congestive heart failure, cancer, arthritis, blood pressure. Same rules apply. If you're going to a clinical referral source and all you have is your brochure with a 77-year-old man riding a unicycle, eating an ice cream cone, thinking that there are butterflies around their head and they're skipping off and sitting on a park bench, that's not the real world. You're looking like everybody else with those brochures, and they're not passing them out to anybody. What will happen is they'll say, yeah, leave them in the lobby, and you'll go and leave them on a coffee table, and your competitors will come and steal your brochures. And if you're really unlucky, they'll steal your brochure stands too. I'm not saying I ever did that, but I've seen it done. So what you need to do is give them disease-specific brochures. You are asking for that one specific patient on every visit. None of your visits sound alike, and you're increasing your pie by asking for a slice at a time instead of the whole pie, which you're never going to get anyway. And here's some more: heart disease, diabetes, COPD, mental illness, osteoporosis. And remember, these are all can be customized to your agency, your colors, your logo, your message. But they're very effective because, same thing, if you accompany these brochures with a care package that you've designed with specific things in mind. The patient with COPD, you have a COPD patient. A post-operative patient, you have a post-operative private duty care plan. So you're hitting the market with private duty disease-specific stuff: wound care, Parkinson's, stroke, pain management. A lot of my private duty clients are really excited, and they're looking at the ways the hospital is making their money and where they can fit in, and they're calling on the hospital by saying, yeah, we can take care of your CHF patients. Once you know their value-based program initiatives, that would be so low on their priority list as to take up their time and listen to how you're going to keep a patient in the home with a cardiopulmonary diagnosis, because they first have to worry about skilled nursing facilities and skilled home health providers in the prevention of these patients coming back in. So here's my message to you guys. If you really want that business, you're calling on the wrong referral source. Your referral source is skilled nursing facilities and skilled home health providers. And your message is, when you send these patients home, we're high touch. We can make sure they fill out a patient scorecard for you. We can provide them an admission packet where we're giving them all the tools they need to do their vital signs and write it down on a log. We can furnish you this every 2 weeks. You can, in turn, give it back to the general practitioner as a report on how the patient's doing every day. We keep the patient compliant in the home. We're an adjunct care provider to your skilled nursing services. This will make you unique. You can go to a referral source and say, I can promise you a patient scorecard every 2 weeks, Mr. General Practitioner. And because of that, just looking at my patient scorecard on a biweekly basis would qualify you for your 30 minutes of in-home supervision for care plan oversight. Me providing you a patient scorecard every 2 weeks and you evaluating that and possibly doing changes in medication or calling into the home with special orders or not. But it's proof that you reviewed that patient episode in the home for 30 minutes that month, and thereby you're valid to bill for care plan oversight. So private duty agencies, team up with your other partners out there, your skilled nursing facility and your skilled nursing home health agencies. Also, team up with your hospice agencies. Put together palliative care packages. They really need services that you can provide. So just imagine hospice is doing some bed and bath service in the mornings. They're paid on a daily rate. They can't afford to do it more than once with an aide. But you would have a package put together, a palliative care package, where you could replicate that service in the evening. The service is still needed other times during the day. So here's how we would create a disease-specific private duty service flyer. We would make it so specific, we would draw out certain things for certain patient populations that we do anyway, but we want to have benefit. Remember what I said. Anytime you're calling on a clinical referral source, it's not just we see this, so we've done that. You got to give them a benefit. You got to give an expected outcome. So when you're talking about with arthritis patients preparing meals, then you're drawing it out. The benefit is to maintain correct diet and avoid discomfort. We assist with sewing and writing to provide fine motor skill support. We assist with laundry to avoid lifting and avoid joint distress. We assist with housekeeping. The benefit is we prevent pain and provide safety. We apply scheduled heat or ice packs as ordered to relieve discomfort. We assist with proper transferring to prevent further joint damage. So private duty agencies, hear me loud and clear, you can never get this much information out to a referral source by showing up and saying we love our patients more than their grandchildren do, and our bill rate's $18.50, which is 50 cents less than our nearest competitor. That means nothing to your clinical referral sources. However, these care packages will. Here's a diabetes care package. We prepare diet-conscious meals. Benefit, to help stabilize blood sugar. We monitor skin conditions. Benefit, to prevent skin breakdown and extremities. We monitor medications. Benefit, to ensure maintenance medications are taken. We monitor and record blood sugar readings in a patient logbook to ensure proper insulin dosage and compliance. And through that, you can back in report either to skilled nursing or directly to the physician. But now, you're talking their language, right? You're talking about the care of their specific patient population, not this generic, we love people. And, you know, if you could show up with your compassion in a bucket and have the competitor's compassion in a bucket and show them the difference, you'd be all right. But you can't do that. So those type of cell lines, they just don't mean anything to our referral sources. So Alzheimer's disease, we have brain fitness exercises to keep client engaged. We do direct patient supervision to prevent wandering, medication reminders to keep client compliant, toileting reminders to eliminate incontinence and prevent skin breakdown, social stimulation to combat loneliness and depression. You're drawing out all these things in a 3-hour or 4-hour package to your clinical referral sources, and they're going to be surrounded by benefits that you're going to do with your aide being in the home probably about 3 hours. So in this Alzheimer's disease, you're also going to have assistance with bathing, meal preparation, dressing, change. You list all those things, and you know, and the aide knows, it's going to take 3 hours to do that, and your bill rate's $20, but you don't lead with that. You lead with all this benefit, and you say, our Alzheimer's disease care package is $59. You can have it 1 day a week. You can have it 7 days a week. We have deluxe packages as well. It'll all lead into your backup pricing, your hourly pricing, and your day rates and everything anyway, but these lead packages are very important to referral sources because it makes a lot of sense to them. They're going to get all this benefit for this price. No one else in your market, if you're the first one to hit it in your market, in that pricing model, that benefit model, then you're going to lock everybody else. There's nobody else to compare you to when you're leading with benefits. So it's getting close to calendar season. Calendar is a great buy for top-of-mind exposure. The average calendar is looked at with your logo and contact information over $6,000, 6,000 times a year, 6,000 times annually. So they're very effective. The return on investment's really great. Promotional campaign items that we always buy, calendars, have a return of promotional profit dollars of about 5 or 6 times normal promotional. Average person views a calendar and its contents 4,380 times a year. That's if they're in the home. The average workplace environment calendar in full view of a workplace physician or clinician, it's over 6,000. So the numbers are there. We have our 2012 condition-specific calendars coming out. They're going to be launched in the next 2 or 3 weeks, and all of them are customized or have the ability to be customized, but we have some really great template versions, and here's some of them that you can see. Inside the home health calendar is a description of your home health services or their disease-specific, talking about patient populations. You're much better off talking about how physical therapy can add to a patient's quality of life. Remember yesterday when this webinar began, I told you, you got to reach out to them with the benefit, an initial benefit statement that here's what I can do and here's how I can do it. So you talk about them more than you talk about yourself. The mistake we make is we talk about ourselves too much. Home health calendars also has the Medicare decision tree, which would tell a clinician or physician who would be eligible for Medicare home health referral. Here's our hospice calendars. They're either hospice service oriented or hospice in-stage indicator, talking about specific disease populations. And we draw out the in-stage indicators in a supplement tear out of our hospice calendars. Here's our private duty calendars, and we go with private duty services, and we go with private duty disease-specific messages. And the tear out there for the clients and referral sources is important information and contact sheet. There's a lot of specific things that you can add to calendars. You can make it your own. We have branding for a lot of home health, hospice, and private duty agencies all across the country. They're really happy. We can make it look how you want it to look. So, I know I got a little bit on my soapbox today about certain items. I love disease-specific marketing, guys, because honestly, if you're looking to differentiate yourself from your competitors, you have a different talking point on each and every sales call. And if you need your marketers to know more about selling home care services, then tell them to give me a call. You can go and look at the home care specific calendars and even upload your own logo and contact information by going to homecarecalendars.com. If you need to talk to me or another home care sales coach, we'd love to talk to you. We have a lot of information and ideas we can share with you. On disease-specific marketing, we can take it down to whatever level you need to take it. Remember those presentation models I talked about? We can put together whatever you need to. You don't need your sales staff reaching out and making some lower quality presentations to fulfill, here's the deal. I'm going to be honest with you. You owners, agency managers, you spend $500 on a lunch because you're having to feed 30 people just to get the attention of the decision maker. you need a professional presentation. If you've invested that much, it's cheaper to buy the presentation and do a one-on-one off your laptop. And the beauty is you buy the presentation one time and it's an open template. You can modify it. It's 99% done when you receive it. All you do is upload your contact information and logo, but it gives you value. It gives your presentation meaning. And you're not just over there trying to talk over people who's arguing about whether this is ranch or blue cheese dressing on their salad, and you're trying to tell them how great your agency is, and they start talking about Dancing with Stars contestants, and after a while you just say, well, thank you, and leave. This is a genuine benefit message that you're going to give referral sources. So call me. Or go to myhomecaresalescoach.com and get your free coaching call. For a great newsletter template, we didn't even talk about newsletter templates, but that's a great way to keep top of mind, especially private duty services, with your clients. You want to go to www.homecarenewsletters.com. There's hospice versions, there's home health versions, and there's private duty versions available for your inspection. You can go online, homecarecoachingcall.com, or go through our website, www.myhomecaresalescoach.com, to schedule a coaching call, talk about any of these things that we talked about, any webinar that you've seen in the past or on this webinar. We can put a program together that would make you different than your competitors, I guarantee you that. If you're looking for great marketing items that you've seen on the webinar today, including other ones that we didn't go over, you can't beat the quality. We do our own printing here. Remember the tag team, we do it all. Soup to nuts. We're a full-service marketing team here at your disposal. The way to reach the sales side is www.tagwebstore.com. Visit that. Look at all the unique items listed up there. And remember, all of our items can be customed to your message and your agency's look. If you do want to come by and take me up on my tour offer, come to Franklin, Tennessee for a day and a half and go away excited and full of ideas. I just want you guys, if you've enjoyed this webinar and this old Carolina boy talking real slow but kind of making sense to some of you, then you go to www.bigreferralsbootcamp.com. Click on some of those testimonials. Of all the people, we offer a full money-back guarantee on our boot camp. And we've had hundreds of people come to our boot camp. We've never been asked to return any money. No one has ever left thinking that they didn't get more than the value by coming here and learning some of the, it's just mind expanding. When you come here because the truth is, we do what we do, we're clinically driven, but we don't know what we don't know. So if you don't know what you don't know, come here to Franklin, Tennessee, and come to one of our Big Referrals boot camps. But by all means, go to that website and look at some of the testimonials. They'll blow you away. Here's our contact information. You can call in direct to our line, 1-866-232-6477. Ask for Reba. Reba can give you samples of anything you saw today and more. If Reba's busy, ask for Cindy. If Cindy's busy, ask for Brian. If Brian's busy, we'll pull somebody in off the street to answer the phone or something. But we will answer all your questions today and make sure that you are contacted through homecarecoachingcall.com. Remember, on the first slide of our webinar presentation, you can go to www.youtube.com/tagwebinars and see a host of webinar topics that have been given in past seasons. So I'm just wanting to look at some of the questions that came in. And I have a question about the brochures. Are they totally customized to my agency? And yes, they are. They can say what you need them to say, and they can look like you need them to look. I always say that TAG is, if you can dream it up, TAG can make it happen for you as far as home care marketing. Got a question on the boot camps. When's the next boot camp? We have a boot camp coming up August 25th and 26th. And we do have another date, I think it's the 23rd and 24th of September, are the two scheduled boot camps right now. But if you want to, it says how many people can attend the boot camp. Anywhere from 1 to 10. We hold our boot camp list to 10 people. You get a lot of direct training about your specific market territory. At these boot camps, we don't make it a big joint thing, so you get a lot of personal attention. So 1 to 10 is the buy. Right now, I think there's 2 seats left in August, and there's probably 4 or 5 left in September. They fill up pretty fast. We don't market them too much. But you need to call Rebecca at 1-866-232-6477, and first one in wins. We'll fill these up pretty quick. I got a message from Delaware, and they're commenting about, yeah, you were right, you do talk kind of slow. But I assure you I'm not on medication. I'm just from South Carolina. That's the deal. But they're asking about the seminar cities. They had gone to Philadelphia, and they loved it. And when are we coming back out on the road? We're coming back out on the road the end of the 3rd quarter and through the 4th quarter this year. We're going to hit some cities in Texas and the Carolinas. We're looking, not Carolinas, but Atlanta. We're looking at some in California. But if you have a great idea on what city we should come to, or if you would like our presentation in front of your entire sales team, we can make it happen for you. Again, just contact us, eric.crump@theadamgrp.com. And Jennifer says, Eric, we're not slow in South Carolina. I know we're not slow in South Carolina. We just talk slow. That just gives us more time to think about what we're saying. We're smart, right? We're smart in doing that. And you know, I never have any disparaging words about my homies. I got another question about the hospice flip charts. The question is, how many, what's the minimum you can purchase? I think 50 on both the home health admission and hospice admission flip charts is the minimum buy. But they're very effective when you go out to the referral sources, because you're going to be, in most markets, the first one. The guidelines for home health admissions only been out, it's been out less than a year. We introduced it 4th quarter of last year, so it is unknown in most markets, your clinical referral sources. And trust me, they don't go stale like your bagels and donuts. Your referral sources will keep them for years. I got a question about the on-sites and what all's taught on on-site presentations. I even hate to mention this, but I will, since you guys are my buddies and you've stuck with me the whole time. We have an exciting new project that we're working on called tentatively called our TAG University, where we're going to put up online courses, sales and marketing courses directed toward home care. But to tell you, we can go to your specific agency and teach marketers and market training. We have over 24 hours, I think it's 27 hours now, of specific classes. And you can pick from a menu of classes that you want taught to your marketers. Everything from the rudimentary home care sales process training to putting together these community-based transition programs or specific pressure ulcer programs and campaigns for skilled nursing facilities, really technical classes as well. And here is Mr. Suma. I just got off the phone with Mr. Suma this morning. Mr. Suma, you will be able to download this webinar, but I will send it to you in my follow-up email to you anyway. I'll send it as a link where you can go online and get it. A version of this is already on. It was given last winter, so it's on youtube.com/tag-webinars. There's a ton of webinars there. We try to give you as much information as we can. The best way to get it, though, is come right here to Franklin, Tennessee and get your mind blown. Okay, guys, I got some more really nice things being said, and I appreciate you guys saying all those kind words. If you need to talk to me, you know where I am. Give me a call or go to homecarecoachingcall.com. Remember, I'm Eric. We're TAG. We're here to help you grow your referrals and revenue, and enjoy the rest of your day. Thank you.